Cool. So, hey guys, I'm really excited to be joined by Dr. Nigh today. I actually kind of connected with his talks on a few summits I listened to, and he was really diving into the hydrogen sulfide issue and why this could be occurring. And he just had some really interesting information that I thought would be really helpful for a lot of people dealing with SIBO or really any gut issue, right? So I'm excited to kind of introduce Dr. Nye and dive into a little bit of, what he's figured out working with gut issues and this hydrogen sulfide issue that could potentially be causing some issues in a lot of people. So I'm just going to do a little introduction. Dr. Nye he co-founded Immersion Health in 2014 after completing both the Naturopathic Doctor program and the Master of Science in Oriental Medicine program. And during his early years of work, he developed his interest and passion for researching and implementing alternative cancer therapies. He's widely respected in the naturopathic profession and has spoken several times at, different conventions and different events. And just a great wealth of information. And I'm super excited to just chat with him today. So for anybody who can you just give us a little introduction of yourself, even though I kind of did it, just where you live, kind of what you do?
Yeah, sure. So let's see. I live in Portland, Oregon, and I graduated in 2001. And just so people don't think I started my work in 2014, I graduated in 2001. Initially went into practice in 2002, and so been in practice since then. And then Immersion Health was the most recent incarnation of that. Let's see. My clinical focus really, probably 70% of my clinical work is with cancer patients and doing really intensive kinds of treatment with cancer patients. Yeah. And then I kind of, I'm a geek and I love to just dive into various topics. And at one point I kind of stumbled into sulfur as an issue. And as I got to looking into that more and realizing all the huge range of problems that it can happen if sulfur metabolism gets messed up, sort of blew me away. And so I developed a whole clinical program for people to find out if they have this sulfur thing. And it was through that I came into this world of SIBO, with patients kind of came to me initially. I actually don't even consider myself a SIBO doctor.
Yeah.
It's just that patients started coming to me because I was doing the sulfur thing, and they said, maybe this is me. So I would work with them on the sulfur issue, and lo and behold, their SIBO symptoms often would have a pretty dramatic improvement. So that's how I came to it all.
Yeah, that's really interesting. I think it's really cool, though, too, because I think it's important to remember for even people who have been told they have SIBO or have a gut issue that, there's many different reasons why that could be happening, right? And I think it's really cool that you came to it from a different perspective and can kind of bring that to people who are maybe haven't had success with antibiotic treatments, or, they've lasted for like 3 weeks and then everything's come back. So really cool that you came into it from a different pathway and can kind of bring a little bit of a different take, which is really good, I think.
Yeah, good. And I don't use any antibiotics at all. I'm not trained in that. I don't really. So I think maybe it is an advantage that I don't know what the standard protocols are for SIBO.
Yeah.
I really don't. I haven't studied it, so I do come at it from a totally different place, and it seems to be helpful for a lot of people.
Yeah, it's good, and I think it's why it's always important to have different takes, different opinions on how to solve problems, right? Because we can get kind of echo chambered sometimes in the conventional way of doing things.
Sure, yeah.
So yeah, I kind of would love to dive into the hydrogen sulfide, and then how this kind of applies to SIBO patients or people who kind of maybe fit the mold. So the first thing, I kind of want to just go over simply like, can you just tell us a little bit about how our body converts dietary sulfur or sulfur we get in from food or into our bodies, and how that cycle works, and what it looks like when it's going well, what it looks like when it's going bad,
Sure.
and then so that stuff.
Yeah, because this is the crux of the issue. So if we back up and take that 20,000 feet view of things, so dietary sulfur is our only source of sulfur, and our bodies need sulfur in a huge way. All of our connective tissue, and not only that, but sulfate is really the gold. So sulfate is something that our bodies have to have constant access to in order to produce heparin sulfate, for example, which is all of our connective tissue is riddled with heparin sulfate. All of our cell surfaces are covered with heparin sulfate, and at the same time, sulfate is so the various steroid hormones are sulfated, right? So there's DHEA sulfate, there's estrone sulfate, there's testosterone sulfate, and even vitamin D and vitamin C, and they're all sulfated. And it's considered that sulfate is, when a hormone is sulfated, it becomes the inactive form. I don't think that's the right way of thinking about it. Moving sulfate through the blood, sulfate plays a critical role in maintaining the viscosity of the blood. So sulfate has a gelling effect on the blood, but it has to be, you got to have just the right amount or else you overgel things.
Yeah.
And that's in balance with nitrate, which has a thinning effect on the blood. So sulfate and nitrate have this balance they have to maintain. But okay.
Yeah.
So the body has to constantly produce sulfate.
Yeah.
The normal routes come in, and the various sulfur compounds that come in dietarily ultimately have to pass through a set of steps where it gets oxidized usually from either elemental sulfur or a sulfur dioxide or even sulfite. You got to get it to SO4, which is sulfate.
Yeah.
If something happens that doesn't allow that chain of events to occur, that you can't get to sulfate adequately, the body has to come up with a workaround.
Yeah.
The workaround that happens is that you overgrow bacteria that will take dietary sulfur and turn it into hydrogen sulfide and sulfite, because those, not the sulfate that you want, but those things can be converted to sulfate in the periphery. Yeah. Instead of making the sulfate in the gut, they diffuse into the blood, and the cells out here where sulfate is needed, it can happen there. So hydrogen sulfide is the primary substrate that is used to create sulfate out in the cells, which is where it's needed. Yeah. So the key to understanding, understanding this whole thing is what has happened that has blocked sulfate metabolism. Because if we don't figure that out, the body's going to keep growing those bacteria. The symptoms are going to keep coming back.
Yeah. That's really interesting because a lot of people talk about and realize that one of the types of SIBO, right, is an overproduction of hydrogen sulfide gas, or an overgrowth of the bacteria that produce that. And it's really a cool, it makes a lot of sense when you think about it that, there's a reason why, your body is trying to produce more hydrogen sulfide gas, because it needs to get to that end goal of sulfate, right? To help your, all your tissues, everything in your body that sulfate is necessary for. I guess an optimal cycle, kind of, how does that look exactly? Let's say someone who doesn't have an issue getting to sulfate with that conversion in the body. Can you just give us maybe a little?
Sure.
Yeah.
Yeah. So the optimal cycle, when sulfur sources come in its various forms, ultimately the enzymatic steps end up through this enzyme called SUOX, sulfide oxidase. So the various bacteria end up generating sulfite, SO3. Sulfite oxidase oxidizes that to SO4, generating the sulfate.
Yeah. The
sulfate at that point goes through the portal vein to the liver, where the liver either uses the sulfate in the process of detoxification, which is phase 2 detox in the liver, or those sulfates get stuck onto all the different hormones that are needing to be sulfated and then distributed to the body. Hydrogen sulfide in a healthy situation, is a minor byproduct. Now, hydrogen sulfide is now recognized as what's called a gasotransmitter. So there are three of them that are these molecules that are a gas that diffuse into the blood, and once in the blood, they travel around and they have lots of beneficial therapeutic effects. So hydrogen sulfide plays a role in memory formation and cognition, which is why when it's in excess, people complain of brain fog and anxiety and things like that.
Yeah.
Hydrogen sulfide has a regulating effect on the heart. It has a regulating effect on blood pressure. It is anti-inflammatory at low doses. And so there's a constant trickle of hydrogen sulfide that is being generated all the time. That's normal.
Yeah.
So that's kind of what a healthy sulfur metabolism looks like.
Yeah. So you're saying that it is important that we need a small amount of hydrogen sulfide, right? It's just the problem occurs when, for some reason, we're not being able to convert to sulfate, and the body reacts by producing more hydrogen sulfide, and that's when we get symptoms related to it. Is that kind of correct?
Yeah. So I think that there are a few reasons that sulfate metabolism messes up. One of them clearly is toxicity. So various heavy metals, and in particular glyphosate. So glyphosate is the Roundup, the active ingredient there. And I should just preface this whole thing by saying these ideas that I'm sharing are, certainly the clinical aspect of seeing how this stuff plays out is my piece of it. And the real work on sulfate and sulfur metabolism is the work of Stephanie Seneff at MIT, who has really worked out sulfur, and she and I have done some collaboration on papers on this stuff too. So it's when the things that block sulfur, the normal metabolism, there's toxicity, there are genetics, although I actually think that genetics, they get a lot of attention, but I think they're a relatively minor player.
Okay.
It's not that they're not a player at all, but they're a minor player.
Yeah.
And then there's nutritional issues. So nutrient cofactors that don't allow these enzyme systems to run the way they need to.
Okay.
And so one or more of those issues can come together to mess up sulfur. And our modern world is so freaking full of toxicity now that all these chemicals can bind. Sulfur is a binder. It chelates things, right? So, when various chemicals come through, and the sulfur in our bodies will bind those chemicals. And when it's in the liver doing detox, that's a good thing. But when it's not in the liver doing detox, that's a bad thing, because then it's impeding normal sulfur flow.
Yeah. Interesting. So, like, for example, with glyphosate, does it happen like over time, being exposed to that over time? Like, how much glyphosate exposure can cause maybe this issue? Do you have any?
Yeah, I think a lot of this is still being figured out, because there have been no widespread studies on really trying to match glyphosate exposure to specific. Most of the work is being done at the theoretical level. So, for instance, Stephanie has many articles showing the correlation between the rise in glyphosate use and all these various chronic diseases. Mm-hmm. And I guarantee that if you map out the increase in SIBO, it would very closely correspond to the use of glyphosate as well.
Definitely.
What we know is that glyphosate in cell cultures, glyphosate has toxicity at levels of parts per trillion. Tiny, unbelievable small amounts have toxic effects. At the same time, we know that the FDA allows 30 parts per billion on oats, for example.
Yeah.
And so we are eating an amount of glyphosate. And in fact, there's studies that have looked at this. We're all, even those of us who eat mostly organic, we've all got glyphosate in us. And there are known pathways that it interferes with, not in theory at least, not any human pathways, but it interferes with microbial pathways. And of course, our gut bugs are making use of those pathways all the time.
Interesting. Yeah, I just asked because like I grew up as a baseball player, so like I was probably constantly exposed to glyphosate, whether the baseball fields or spraying, and it's just interesting to kind of think about that issue and think about people's exposure to that, and if that could have potentially been a contributing factor to some of their issues. Yeah.
Absolutely. I think, any like around golf courses and, any of that manicured field stuff where it's almost inevitable that there was lots of Roundup being used, and it's just a big experiment on what
Yeah.
what relationship is between those exposures and the later health issues.
Yeah, definitely. So a lot of people out there are probably wondering, what are some of the key signs you see in someone who has sulfur issues? And maybe I'd say my audience is mostly dealing with digestive issues, but I mean that health issues it all goes together. So
Yeah, right. And the fact is that I mean, while SIBO is obviously primarily a gut thing, but when you start asking about the constellation of symptoms, people have fatigue and have brain
yeah,
fog and have, it's that whole picture. And so sulfur, the key thing about sulfur as an element is that I think about volcanoes. It's hot and eruptive.
yeah,
And so people very commonly, the gut issues kind of go without saying. So in fact, if you look up any of the inflammatory bowel diseases, irritable bowel, ulcerative colitis, Crohn's, any of that stuff,
yeah.
there is an excess of hydrogen sulfide associated with all of them.
Interesting. Yeah,
And so that is clear. And then the bigger picture is that hydrogen sulfide and sulfite, hydrogen sulfide causes a drop in blood pressure. So very commonly people have, issues where they stand up and they get all dizzy or they just have episodes of dizziness. It causes lowered heart rate. So it's not uncommon to have people with very low heart rates. And these are people who are not necessarily that are well conditioned.
yeah,
Causes hydrogen sulfide is associated with, like I said, brain fog
yeah.
and anxiety.
Gasotransmitter. Yeah,
So, and skin issues are huge. So commonly people have acne or dermatitis or just rashes or just itch. They just have itchiness.
yeah,
So that all kind of goes with it. Sulfite is a different picture, and some people have more sulfite symptoms, so sulfite causes increased heart rate. It raises the blood pressure. It increases sympathetic autonomic nervous system. So much more anxiety and even panic attacks.
Yeah.
And those can be episodic depending on, what's been eaten and all that kind of stuff. So, but that whole picture very commonly has this kind of something ain't right about the gut. Sometimes that's dramatic. Sometimes it's minor gut stuff, but we've seen ulcerative colitis that's been around for decades. We've seen it resolve in like 3 days by people doing this low sulfur protocol thing. I mean, it's crazy.
wow.
So clearly that about hydrogen sulfide is driving that stuff.
Yeah, that's really interesting. So, I mean, do you see even because like, let's say I've kind of know that I had a sulfur issue. It's gotten better, but like even that the gas is notoriously smelly, right? Like just things like that are kind of key indicators, right? Yeah. It's really interesting. So and then like the production of that too much production of hydrogen sulfide in the gut. That gas in particular can cause, the acne, the rashes, the redness, just by being in the body, right?
Yeah, I don't, I'm not really sure like the exact metabolic connection between hydrogen sulfide and like, for instance, why cystic acne.
Yeah.
Like, I don't know exactly the connection. It's just such a clear connection.
Yeah, definitely.
So, yeah, I think I don't know if it's direct metabolic or it's energetic. I mean, if you look up, like, if you get a book on homeopathic sulfur, and any kind of repertoire on homeopathic sulfur and read it, it's like, oh, yeah, that's what sulfur toxic people look like.
Yeah.
So night sweats. In fact, we thought when I say we, I work with a nutrition therapist, Maria Zilka. I work very closely with her, and so we're kind of always collaborating with these patients. We really thought and maybe we have found a cure for menopausal hot flashes, because hot flashes and temperature, heat symptoms are very common when people have sulfur issues. And so we would have menopausal women with gut stuff, and we put them on the sulfur thing, and they come back and say, I don't have any more hot flashes.
Yeah.
Like, gone. People had like 30 a day, and then they're just none.
Yeah, and it's just fascinating to me because it seems like this is kind of under researched, or it kind of befuddles me why there hasn't been talked about more, right, in the past.
Yeah.
It's really interesting.
Yeah. I think it's really confusing.
Yeah.
I think it's not a topic that is very accessible, because it's like the standard approach, I think, even in the naturopathic world, is to think that it's like at the conventional world. Oh, we've got gut issues. Let's give like Prilosec or something like that. Mm-hmm. And the naturopaths say, no, that's not the issue. The issue are this overgrowth of bacteria.
Yeah.
We have to deal with that. And what the sulfur theory is saying is that the overgrowth of bacteria is not the problem either. Yeah. We got to go to figure out a metabolic issue that is leading to that. And so, it's like, how many layers of this onion are you going to go in?
Yeah.
And I mean, that's ultimately true of virtually anything, that there's always another layer in that you can go to find out, how is this problem actually an adaptation?
Yeah.
And then how do we address it that way?
Yeah, we're really complicated beings.
Yeah, no kidding. Keeps me in business.
Yeah, exactly. So next kind of topic is, so you've seen some success, some good success helping patients with issues that you think are sulfur related. So what can kind of someone maybe talk to their doctor about? And what have you seen that's been helpful for these people who come in and maybe they present with, the typical sulfur type things, like they can't tolerate eggs and they look a little bit red, or they're having some of that, that kind of nasty hydrogen sulfide type gas. Yeah.
So, so clinically, go to your first question. What can somebody ask their doctor?
Yeah.
I don't know.
Yeah.
I don't know. To someone who hasn't, I mean, this is like the problem with this being sort of in its infancy as a line of investigation, that there's not a widely disseminated set of protocols around to do to get that all kind of written up and people trained and all that. Until that happens, there's really not much that there's not like a blood test that somebody can say to the doctor, will you test this?
Yeah.
Now, I mean, possibly, and something that have been interested in, the potential is DHEAS, which is the common way that you measure DHEA. Mm-hmm. The ratio between DHEAS and DHEA, the unsulfated form, I think is probably giving us an idea of. So there was we have to reduce the inflow, and then we have to speed the outflow of the toxic metabolites, and that is really a sort of a case-by-case assessment of figuring out, of those three things that I said can lead to the problem.
Yeah. What
is it for this patient in front of me? And then once you figure that out, you have a set of strategies that come into play. Now, some of it is as simple as doing like the Epsom salt baths, which has been, for example, I mean, that is one of the really useful therapies as a way of getting usable sulfate into people who can't get it otherwise.
Yeah, really interesting. So I just think about, because I've had success doing Epsom salt baths, and that just kind of like, it kind of gives me the question of like, are there other ways to get sulfite into the body too? Whether it's, I don't know, lotion or something like that. It's an interesting problem to solve. So yeah.
Yeah, it's so I do think, especially when people have when when sulfur metabolism is clogged, the skin is a very important way of getting it in because it bypasses the gut.
Yeah.
And so things like Epsom salt baths, magnesium sulfate topically, is not magnesium. Any of the, I mean, there are lots of ways of doing sulfates topically that could be beneficial. Even DMSO, some people do fine with DMSO.
Mhm.
Many people do fine with supplemental sulfur products. And so, MSM, many people, even with sulfur problems, will do okay with that.
Yeah.
Now we never start with it. We always do this sort of after the, after the initial steps of the protocol.
Yeah. Yeah. Another question here is that, so main things are, getting rid of too much sulfur intake and then optimizing the flow of sulfur to sulfate in the body. So do you usually suggest like a low sulfur diet, or is it specifically like, because I've seen diets that are low thiol specific, or so where do you lie on that?
Yes. I do. We do a low sulfur diet. That is so the low sulfur diet is what has to be done in order to get that slows the inflow of the sulfur.
Mm-hmm.
And so, I mean, there are many low sulfur diets out there.
Yeah.
And so which one gets done is, I mean, we have developed our own that we use with people. It's not necessarily, it's not the right one.
Mm.
It's just one that works well for us.
Yeah.
There's no such thing as a no sulfur diet. That's only if you're doing a water fast, pretty much. And even there, often people are getting sulfate in their water.
Yeah.
So that is always the first place to start. Most people, even people who are sulfur reactive, most of them, once this initial clearing thing is done, then sulfur sources can get reintroduced one at a time. And what we find is that most people are fine with most sulfur sources. There are only a few that are the most problematic. And I mean, without question, the top of that list is garlic.
Yeah.
Which, oh my gosh, garlic is supposed to be so good for us. And it is, unless you got a sulfur problem, in which case it's not good for you. And so, I mean, we've had some people, all of their symptoms result just getting garlic out of their life. And for people that are sensitive to garlic, even dusting of garlic will often bring symptoms back. So, it's just trying to figure out one by one which things are the issue.
And that's really interesting because if you think about it, like nowadays people put garlic on everything, so it has to be kind of, you really have to watch that, because even at like, let's say you go to Whole Foods, right, and get like food from the bar there, it's like most of the stuff has garlic on it, so it's interesting.
It's everywhere. I mean, it really is incredible. So but you really do see good results minimizing the amount of sulfur. And even what you're saying is that, let's say they do kind of that cleansing period or that detox period where they kind of get rid of a lot of sulfur and really reduce that. Mm-hmm. They're able to down the road introduce more sulfur and see how their body reacts and see if it's a couple things that are really causing issues or most people, we've had a few hundred that we've done this process with. Like, so we've had a few people who when we introduce any of the sulfur sources back, their symptoms come back.
Wow.
Like that's rare. And I think the primary symptom in the cases where that's happened has been pain. Whatever the pain is, neck pain, shoulder pain, doesn't matter. But people who like can't get off their painkillers, and then we have them do this sulfur thing, and oh my gosh, I don't have to take my painkillers anymore. And then we start bringing sulfur back in, and everything lights them up. So it is, it's a tedious process. what is kind of unknown at this point is if there is some amount of kind of detox and metabolic reworking
Yeah.
that will allow these people to bring sulfur back in.
Yeah.
And that's a work in progress.
And yeah, that was kind of my next question is like, you know, if you kind of work on, you know, that sulfur pathway in the body and like optimizing it, we'll kind of get into what you found that's helpful for optimizing that. But like, if you work on that and you kind of minimize sulfur, if that is able to kind of get better over time. Yeah.
Yeah.
So yeah. It's interesting.
Yeah, it is it can be a slow and tedious and frustrating process. There's some nutrients that will help almost anybody. One that is, I think, known pretty well is molybdenum.
Yeah.
Because it's the essential cofactor in that enzyme, sulfite oxidase, to get sulfite converted to sulfate. So that is, molybdenum is crucial. And I've talked about in some other contexts, there just happens to be one form. Am I allowed? Can I say the name of the particular product? Yeah.
Yeah.
So we had tried various kinds of molybdenum, and the one that worked is made by the company Biotics. And I'm not paid anything for Biotics, but they have a product. It's an organic molybdenum called Mozyme Forte. That's the one that we do. We have people chew up one tablet twice a day. Mm-hmm. Some people would do a little more, some a little less. But some other forms of molybdenum we found were causing lots of exacerbation.
Yeah.
And that's never a good thing. So we just ended up trying that particular form of it, and that's the one we go through probably 20 bottles a week of that stuff.
Yeah, interesting. So your main focus is so minimizing the sulfur for a certain period of time, and then optimizing that pathway. So, but you don't really focus at all on like really, let's say, treating the bacteria or anything like that, right?
You know, it's not that I will give people, so I will sometimes give people lemongrass, because lemongrass will prevent the production of hydrogen sulfide.
Interesting.
For example, or Korean ginseng, Korean red ginseng, because it will regulate the CBS enzyme and also lower hydrogen sulfide levels in the periphery. And for people that have fatigue, that's especially relevant because it's ginseng, and so people can get that kind of boost. So, you know, I will also at times give something like, it's not a colloidal silver, it's a finer particle than a colloidal silver, but it's a silver-based product, because I think it can be very good for helping to control bacterial growth, and not do damage to the healthy bacteria. Mm-hmm. But at the same time, I'm constantly, you know, lots of things like butyrate and other things that are reestablishing the integrity of the gut lining and all of that.
Yeah.
So it's kind of, no, my focus is never on killing the bacteria. My focus is always on the metabolic issue.
Yeah. But
depending on the severity of symptoms, sometimes you gotta, at least initially, give some symptomatic relief.
Yeah. Gotcha. So for the Epsom salt baths, I kind of saw that the study that you mentioned about, like, you know, after 7 days or whatever, kind of the sulfate levels reach their max. What do you usually recommend people try with the Epsom salt baths, and do you start slow in some people?
It's very rare that somebody has a reaction to an Epsom salt bath. It's happened before, in which case, back it off.
Yeah.
But generally, I start people, it's 4 cups of Epsom salt, and you want the bath as hot as tolerable, because you want your skin red, because that's where the exchange is happening.
Yeah.
And soaking for 20 minutes, 7 days in a row. And then after that, about every, I suggest people do it 2 to 3 times a week after that, just to maintain. And the fact is, the study was done on healthy people. And so they found 7 days was enough to fill their bucket with sulfate.
Yeah.
People that are significantly low on sulfate, which are the unhealthy people, it could be it needs 2 weeks
Yeah.
in a row, like, so yeah, I think the majority of people who do that process will report back that, oh my gosh, that's the greatest thing.
Yeah. Interesting. So it's kind of a combination of a number of different factors that you're trying to really get their body, you know, producing sulfate more optimally and kind of allowing it some detox and some time to kind of get away from that, just inundation of sulfur right into the body. Yeah.
Yeah. I think so many of the food sources of sulfur, the reactive food sources, are seasonal.
Yeah.
So garlic and onions and asparagus and Brussels sprouts and cauliflower and there was a time not so long ago when we only had limited access to these things. But now, year round, we have huge amount of access. And in fact, we're taking garlic in pills and we're putting it in smoothies. And it's like we're overloading the enzyme systems that were developed for small amounts. And now we're getting big amounts, plus a world that's toxic that slows the enzymes down.
Yeah. And it brings up that question of like, are we supposed to eat all this stuff all the time, right? It's like back in the day, they used to eat only what they had around them, right? So,
right.
Yeah, it's a good question to ask.
Yeah. Yeah. So, yeah, I think in particular, just because the world has become so toxic and sulfur is so intimately tied to detoxification, that we are especially susceptible now to sulfur issues because we're all clogged up.
Yeah. I'd say one more question on the treatment phase of this issue is I also saw a study like that talked about bismuth. How bismuth can be really effective, but that's have you ever used bismuth? And then like is that more of, it seems like that would be more of like treating the bacteria, but I've also seen that it kind of binds hydrogen sulfide, so it gives some symptom relief.
So yeah, bismuth is one of those. It's not one of my go-to.
Yeah.
But again, if people are miserable, and as you know, many people are, I do think that bismuth can be valuable especially in those early phases, just for symptom management.
Yeah.
It's not a long-term therapy, but it can, it can certainly provide some relief to people.
Yeah, interesting.
It also is somewhat confirmatory when somebody comes in and says, "Yeah, the only thing that makes me feel better is Pepto-Bismol."
Yeah.
Well, then they got a hydrogen sulfide problem.
Definitely.
And I have lots of SIBO patients who come in showing me their high methane or high hydrogen.
Yeah.
And I don't even know what to do with that. I just do the sulfur thing with them, and most of them feel better.
Yeah, that it makes you ask the question of like, even with the breath test, right? Like, we may be missing things still, right? Like because for example, I was always kind of a mysterious case with my doctors just because my breath tests, I had more of a sulfur issue and it would come back flatline sometimes, and they would never know what that meant. And it's interesting because the breath test mainly shows right now just hydrogen and methane. So
I think the sulfur issue is the sleeping giant. Yeah.
So do you think, I know that there was talk of like the development of a test that can measure hydrogen sulfide. Do you think that'll be helpful?
Maybe.
Yeah.
It's helpful in the way that any test is helpful. I mean, ultimately, it's like with food allergy testing.
Yeah.
If somebody, and I used to do a lot of it, if somebody measures that they have no reaction to bananas, but then they tell you, well, every time I eat a banana, I get a stomach ache.
Yeah.
Well, then they got a banana problem.
Yeah.
It doesn't matter what the test said. And so ultimately, the proof is in how they feel when they do this process. And the test can be, any test can be confirmatory, but it doesn't deny the issue.
Yeah. So exactly. So like, even if that test comes out and it does show that, there's overproduction of hydrogen sulfide, it's still going to be like getting back to these core issues, right? Of like, why is this happening? Why is this pathway not working correctly? All those things. So it'll give you,
Yeah.
Interesting. So one other question I'm curious about is, so as far as more of the microbiome, the bacteria that are causing this issue, are there a few types of bacteria that usually overgrow? And I would imagine that these are beneficial in the right amounts too, right?
Yes. So yeah, they're all. I mean, yeah, it's a crazy complex ecology that we got in our guts, right?
Yeah.
And there are the sulfovibrio is the class of the sulfur fixing bacteria that are the most problematic, but there are others that can also overgrow. I don't do much microbiome testing at all because I assume people got a train wreck happen. And so I don't, I don't treat the bugs in particular. I mean, I do. Obviously, I think probiotics play an important role, but I'm not particularly interested in exactly what bugs are growing in excess, because I'm much more interested in what's the clinical outcome of making these changes. And my experience is that when people just do the process, not everybody, there's a lot of people who have what I think are sulfur-based symptoms, and we put them through this process, and they're just annoyed with me that I put them through the process because they didn't really get better. It's like, all right, well, those people will go to plan B. But I would say the majority of people who fit the profile respond well.
Yeah. Interesting. So I guess for anybody who's watching, kind of what are your main suggestions of things they can try to see if it can help them, and then if this may be an issue, just to kind of summarize or simplify it for them.
Summarize or simplify.
Yeah, just like the main things they can try on their own, whether it's Epsom salt baths, supplementing, right? With
so I would say, the headline 3 reactive sulfur foods of all people, the most probable reactive foods are garlic, eggs, and kale.
Okay, kale.
So even if somebody just eliminated those, I think that would be an informative first step. Trying the Mozyme Forte, that alone, even before we've had people do the actual low sulfur protocol, sometimes just adding that particular kind of molybdenum to people's lives, and they have their brain fog clears and things do better.
That's crazy.
So I think that is certainly valuable.
And does that help like the gut stuff as well? When you introduce, let's say the molybdenum is going to help someone and it works really well. Does it help the gut stuff too?
Yes, I think in a very indirect way, not because it's altering a particular bacteria in a direct way, but if somebody so I live in the Pacific Northwest. We have low levels of molybdenum in the soil here. So even people eating local organic food may not be getting adequate amount of molybdenum, which means that sulfite oxidase is not going to run adequately. It also means that aldehyde dehydrogenase is not going to run well. And so you ask people and they say, oh yeah, I had 1 glass of wine and I feel terrible. And so, because they're both molybdenum enzymes, and so by supplying molybdenum, we're simply allowing that enzyme to work. And if, in fact, those bacteria are there to compensate for a lack of sulfate, maybe because that enzyme is not working well, then if you allow that enzyme to work better, it could very well be that the bacteria levels go down. For whatever reason, it seems like it's helping people.
Yeah, that's really cool. So, eliminating those foods, molybdenum, does it make sense to try Epsom salt baths for maybe, 7 days? Yeah.
Absolutely, Epsom salt bath. And it was a shock to me when I did the calculation and realized in that study that we're using actually 4 cups per bath. Because most people I ask if they do them, and a lot of people say, yes, I use like a cup. But it's 4 cups. So, I have people buy a vat of Epsom salt. And then, every night, at least for a week,
Yeah. Have you ever used the I think it's the, those float tanks? They have a ton of Epsom salt in them.
Oh,
Can't remember
I,
what the yeah, I can't remember what the name of them, but that's
yeah,
interesting.
sensory deprivation
Yeah,
tank.
yeah.
Yeah,
It'd be interesting to see if that. I mean, I'd imagine it would be helpful if Epsom salt.
I would think so. The I mean, I would guess so
Yeah,
because of the intense concentration in those tanks.
yeah,
One kind of potential downfall, I don't know, is that there's so much that you're actually not submerged in the water,
yeah,
right? You're
yeah.
you're you're laying on top of the water, so the actual surface area exposed to the water would be
Yeah.
significantly less.
Yeah, interesting. So yeah, those are some good things to kind of test out for people.
Mhm.
So and then I heard in one of your other talks you mentioned Cayenne too about
Oh yeah, yeah, uh-huh.
does that what is that helpful with?
Yeah, so cayenne doesn't actually alter hydrogen sulfide either in production or in circulation. What
Yeah.
cayenne does is block its binding to pain receptors.
Okay.
And so this is in particular for people who have a pain, who have kind of that sulfur picture, and pain is a central component, whatever kind of pain. Some people pancreatitis, some people it's just joint pain, so, diffuse body pain, whatever. Cayenne can be helpful. It's symptomatic relief, but cayenne has a lot of other benefits, so it's not a moot thing.
Yeah.
But yeah, cayenne is really for pain.
Yeah. So kind of wrap it up here. I always like to ask, and I'm curious about, what kind of you're excited about as far as research or maybe, seeing in your clinic if it works. What's kind of on your horizon?
Oh gosh. uh, what's on my horizon? Oh, I got a lot of irons in the fire.
Yeah, just a lot going on.
Just I have my research projects that I'm interested in. Stephanie and I are working on another paper now, which I think is going to be. I'm really psyched about how that one's going to turn out. And really just trying to write some of this stuff up into a book that we can get out so that people kind of have a better sense of how to do this evaluation and the treatment. And other than
Yeah.
that, I just read.
Definitely, but I mean, it's so awesome that you've kind of gotten into this issue and come into it from a different pathway as well, because I think this stuff, can be really helpful to a lot of people and a lot of
Mhm.
doctors, right, who are
Yeah,
having patients where, whether it's SIBO or IBS or a gut issue where they come in, maybe they try antibiotics and they just relapse and they're not really solving the problem, right? So,
yeah. And I was there are a lot of docs and lots of success
yeah,
who are not addressing the sulfur thing. It's not,
definitely.
I don't make no claim to this
Yeah,
being,
yeah,
the one solution, but I do think it has opened a door to a kind of treatment that, at least in my experience, it has worked well for SIBO and
yeah.
lots of stuff.
And it's exciting. It's exciting because it shows that there's other ways you can treat it, right, than just
Mhm.
antibiotics, which is
Yeah,
important.
right.
Um,
Yeah.
so, last thing here to wrap up. Where can the audience, maybe if they want to maybe get an appointment or just even
Yeah.
reach out, where can they kind of find you?
Yeah, for sure. So I am at Immersion Health, which is in Portland, Oregon, immersionhealthpdx.com. My request of the audience,
Yeah, yeah,
whenever these things happen, I tend to get lots of emails.
yeah,
Here's my story. What do you think I should do?
yeah, yeah,
And I just simply can't deal with that.
yeah,
But I do lots of remote consultation with people all over the world. And so if somebody would like to do a consultation, of course, I'm happy to do that. And people can go to the website and find the phone number. Um, so that would be the best way to
yeah.
be in touch. And I'm happy to consult that way.
Cool. Thanks. I really appreciate you offering your time to come on here and just kind of chat about the issue. And I think this is going to be great for some people who can maybe test out some of these things and see if they can get some help from it. So really
Excellent.
appreciate it.
Appreciate it, Josh.
Yeah.
Thanks for having me.
Thanks so much.